So welcome everyone to today's Cooperation Live Zoom call on mental health, where we'll be talking about the issues around mental health, talking about the impact of the recent circumstances on it, mental health service provision, and what we as a cooperative party membership can do to be supportive on it. So shortly you'll be hearing from our fantastic guest speaker, Dr. Rosena Allin-Khan. But before I introduce her, I'll just quickly run through a few technical matters in terms of running this meeting via Zoom. So firstly, just to let you all know, these Zoom's been recorded. We tend to find a lot of our members can't really access it live, so we like to put it on our YouTube channel afterwards to make it as accessible as possible. So just a heads up that you are being recorded. If you don't want to appear in it, just flick your camera off and head to audio only, and that's absolutely fine. You'll also notice you've been muted. That's just to avoid any dogs and doorbells and whatnot in the background, so just keep the call clear. So only those who are speaking will be shown on the screen and have the sound enabled. So following the presentation, we'll hold a Q&A session, and there's 3 ways in which you can ask a question. So you can start by raising your digital hand, which I think is now under the reactions tab at the bottom of your screen. You can post your question in the chat box, which will go straight to Izzy, who's helping me out, or you can send it to events@party.coop, which has been monitored as well by Izzy. So when it's your turn to ask a question, I'll introduce you and you'll be asked to unmute, tick the box, and you should be able to fire away with your question. So I apologise in advance, we might not be able to get through all the questions. I know there's a really good number of people joining us tonight, but if we all keep our sort of points as concise and straight to the point as possible, we'll hopefully get through as many people as possible. So that should be fine. The event is being closed captioned, so to enable this, you just need to turn it on in the bottom of the toolbar. And finally, just as always, the Cooperative Party, we obviously believe that our values should be reflected in our actions as well as our policies. So we want everyone to feel safe and welcome tonight. So please just bear that in mind with any contributions you make. So with all that being said, I'll now pass over to our fantastic guest speaker. So I'm delighted that we've been joined tonight by Dr. Rosena Allin-Khan, the MP for Tooting, the fantastic Shadow Minister for Mental Health and a good friend to the Cooperative Party. We all know that this pandemic has had such a significant impact on mental health in this country. And since the early days of it, Rosena has really been leading the charge to address these effects and hold the government to account on the many areas sadly that they're falling short. So in such a critical time for this issue, I'm so pleased Rosena's here to join us to tell us more about this, the state of affairs, the work she's been doing, and what we can do to help her. So without further ado, Rosena, I'll pass it over to you.
Thank you so much. Oh, friends, it's just brilliant to see you. I wish we could all be together in the same room, but just seeing your faces just certainly buoys my spirits. And I know there's something about, the fantastic Co-op Party that even a pandemic can't stop us coming together and can't dampen our spirits. And I think tonight there are so many of you here, and it's just brilliant and a real sort of testimony to just what we do and how we step up and how we come together. And I think it's a really good time to be talking about mental health. But I thought what I would do is take it back to the beginning of the pandemic and talk about some of my work on the front line, because that would feed into some of the campaigns that we've had regarding mental health and some of the plans and strategies going forward and some of the challenges that we've been seeing in our communities, if that's okay. And then I'd really be delighted to take your questions. But obviously this time last year, nobody could have foreseen how our lives were going to be turned upside down. If somebody has said to us a year ago that you won't be able to see the people that you love the most in a care home, you won't be able to go out and see your friends, people you know will be hoarding toilet roll, and you will lose colleagues and loved ones, we all would have said, sorry love, give over, I don't know what zombie movie you've been watching. And we've seen in slow-mo our lives change over this year. And I dropped sort of campaigning in the deputy leadership competition. I was having the time of my life trying to convince people to vote for me, and all of a sudden this happened and I stopped all campaigning and I went to do as many shifts as I could in A&E on the front line back in March, and then also went to work at the Nightingale as part of the family support liaison team. And very quickly I saw how crippling this virus was, how it stripped the humanity out of grieving. And I thought myself pretty hard, having been a doctor for so many years, having worked all over the world in war zones and conflict situations. I thought I was pretty good at managing grief and my own mental health in very difficult scenarios, but nothing could have prepared me for breaking families' hearts apart in full PPE, telling people they had to choose one person to come in and say goodbye, you know, to the person that they love the most in the whole world. I never thought in my career I would ever see that day. And yet we have a government that have presided over one of the worst death rates in the world, one of the greatest number of healthcare worker deaths in the world, and people robbed of seeing their loved ones in care homes, robbed of the opportunity to say goodbye. And we've now seen that they're trying to rewrite history by saying there was no problem with PPE in the first place. And if there was no problem with PPE in the first place, why did we lose so many frontline healthcare workers? Why were nurses having to use bin bags? Why were paramedics having to reuse gowns? Why were school classrooms trying to make face shields in the tech labs? Why were people dying in the numbers that they were? And it was very quick to sort of realize that not only were people suffering with their mental health in our communities, but that people who were already suffering with their mental health were not getting the support that they needed because lots of services had shut down, particularly peer support services. But also our staff, our frontline staff were suffering with PTSD. So we came up with the Care for Carers package where we said, look, our frontline staff, whether you work in a care home, whether you are a porter, a doctor, a nurse, a cleaner, you have seen and lived through very, very difficult things in serving our communities. Look, the Co-op Party know exactly what it's all about to step in and serve your community. But people have paid with their lives over this. And colleagues had to watch their staff members die, their friends die. Colleagues were asked to go in and clean rooms where someone had died of COVID without adequate PPE, and people were suffering. But the government refused to listen. They refused to work with me on this Care for Carers package, but we never gave up. We kept going. We kept on fighting. In the meantime, as the months rolled on, the Centre for Mental Health published a report saying that as a result of the pandemic, and this was the first wave, people were, well, up to 10 million people, 8.5 million adults and 1.5 million children were going to be needing to seek support for their mental health. That is a staggering number. Imagine what it is now. We have young people who've been suffering with their mental health. I've seen children come into the emergency department, younger and younger, self-harming, suffering with their mental health. And in this second spike, which, to be honest with you, was worse than the first, just having to watch 3 children under 5 talk to their 28-year-old mum who's in a coma, begging her to come home over a Zoom call, leaves you with this pit of pain in your chest. And the thing that I found hardest to wrap my head around, and the thing that keeps me going and fighting, and I will never give up, is knowing how much of it could have been avoided. Knowing that the government knew in February, they knew a year ago that our BAME communities would be adversely affected. They knew that our poorer communities would be adversely affected. They knew we didn't have adequate PPE. They knew, which is why they gave multi-million-pound contracts to their Tory donor mates. And it's our communities that have suffered, our people that have died. And this virus has laid the inequalities in our communities, it's laid it bare. But we also know that you are more likely to suffer with mental ill health if you live with inequality, if you come from poverty, if you come from insecurity, if you come from certain ethnic backgrounds. And these are the same communities that were ripped apart by this virus, not feeling as though they could self-isolate because they wouldn't be able to go to work for their less than minimum wage paid job, coming back to multi-occupancy houses, wondering how they were going to feed their kids. And this government left them high and dry. It really did. And when I said to Nadine Dorries, my opposite number, In one debate, I asked her 8 times to meet with me to discuss the Care for Carers package, for example. And she told me if I wanted to inform policy, we need to try harder at the next election. Well, Nadine Dorries, we will try. We will keep on trying. We are never going to stop. We are coming for this government. We're not going to let them forget it. We're going to keep on reminding them. We're not going to let them rewrite history. And we're going to stand up for every young person that is now suffering with an eating disorder as a result of their mismanagement of the pandemic and feels lonely. We're going to stand up for every single family that's been robbed of a precious year of life with their loved one in a care home, many of whom haven't got many years left. We're going to stand up for everyone that were told their job was unviable and they should think about retraining again and getting a better job, causing them to question their whole livelihoods and how much they're able to contribute to their families. We're not going to let the government forget that they failed on the PPE contracts. They failed to protect the people that went into work to protect us. Yes, NHS workers and care workers, all right, clapping is nice, supportive. Clapping doesn't pay the bills. Clapping does not pay the bills. Clapping doesn't bring your loved ones back. Clapping doesn't stop your long COVID. Clapping doesn't put food on the table. We still have nurses needing to use food banks, and we are not going to let the government forget it. But we are sitting within a mental health crisis now. More people are taking their own lives. More people are suffering with mental ill health. And we have a once in a generation opportunity to have this mental health white paper. And I'm going to be standing on their heads, scrutinizing it at every turn, making sure that we fight for the people that need us the most. But most importantly, friends, most importantly, comrades, we need to stay close, stay together, and hold this government to account. And you don't just have to do it in a green chamber. We do it by coming together, campaigning. We do it by all the wonderful campaigns that you have got going at the moment. It makes me so proud to be, to be part of this. But most importantly, we have to keep on holding this government to account and call out their BS, because there's a lot of it. And when Matt Hancock went on Sky yesterday and tried to rewrite history and say there was no shortage of PPE, put a video together, so did many of my colleagues, to say, you might try, but we are not going to let you forget. So I'm going to end here because I'm really keen to have a discussion, but it's so important to know that we all have a voice. And even though we aren't in government at the moment, we will be. And so we have to plan ahead on the strategies that we want the other side of COVID. We have to hold tight. We have to help our communities rebuild after this, because there is a mountain to climb when it comes to rebuilding, how we support each other, how we collectively grieve. But we can do this, and we will do this. And there is light at the end of the tunnel. We know soon we're going to be able to hug each other. Soon we're going to be able to meet. Soon we're going to be able to knock on those doors. But in the meantime, we pick up the phones and we keep on campaigning for the May elections, because those are coming up. We've got some seats to win. We've got some jobs to do, and I'm here for it, and I'm here with you. So thanks very much.
Thank you, Rosena. So much in there that we'll recognise and want to be on board with. I wonder if it's just worth us cracking with the Q&A, because I know there's so much more we want to touch on there. And again, I encourage everyone to start getting those hands up. Chris, I can see you've got. We'll get to those shortly. I'll just start with a couple we've had sent before, and Rosena, and it focuses really importantly with 1 or 2 questions on this around child mental health. And we've seen those figures that show the mental health crisis in children, the devastating ways it's manifesting itself in self-harm and these kind of elements. We've all felt the impact of being alone at various times during the last year. But for those sort of young children who are at that really sort of formative stage of the development, particularly social development, not going to school, not seeing friends, do we know yet the impact on schools and children? Do we know yet what's in store for them and what's being done around that? There's 1 or 2 questions on that where I think people want to know, do we know what's happening yet to children in terms of that mental health impact?
Yeah, thank you. Well, we already know that there has been an impact in 2 ways. There has been a significant impact on children with pre-existing mental health conditions. Studies have shown, I won't bore you with all the stats, but studies have shown that many parents who had children who were reliant on mental health services, who had those stopped, felt that they still had really needed them and were suffering as a result of not being able to access them. That's one group of children and young people who have been struggling. We know that there is an immediate impact on children's mental health at the moment that manifests itself in different ways in different age groups. We also really need to not forget the under twos. There's been a lot of talk about children of school age and even children at nursery, nursery and preschool at ages 3 or 4. But we also know that there has been a significant impact on children 0 to 2 who haven't been able to form normal relationships with family members, who haven't been able to engage with other toddlers and children in certain environments, and the impact that that's had. But the true long-term cost of this is yet to come. It's yet to be known. And comparisons have been made to post-Second World War. And the data shows that if we were to follow that sort of trajectory, we are looking at ongoing mental health impacts for some children for the rest of their lives as a result of this pandemic, which is why we cannot let up on the issue of mental health. And my opposite number in government always tries to say that, it's like lots of people are struggling with their with their well-being, but they're not struggling with their mental health. Well, no, that's not true. They're struggling with their mental health. You can be feeling a bit down and a bit fed up and a bit like you want to stay in the same set of pajamas for a week, but that's very different to what we're seeing a lot of, which is the number of eating disorders going up, self-harming going up. And I think as well, there is a lot of pressure on young people who have missed exams, because the way our country is set up now, people generally aren't told when you're a teenager that you're a success if you're happy. And if you want to go and open up a local florist or a local cafe, that's a really good job and you're happy and you can provide like a life for your family. People are led to believe that their value is driven by their exam results, how they do in maths, English and science. And that pressure, I think, has a huge knock-on effect to how children who have missed exams feel, because they feel like, oh my goodness, my sense of worth comes from these exams I haven't been able to sit. What does that mean for me? And I think that has a huge impact on people.
Absolutely. And I think we've had a message from Anne as well saying, just before we've gone, I'm going to ask Chris, Councillor Jasbinder, and perhaps Andrew to come in next, but Anne mentioned in the comments as well, sort of leading on from that, what's the impact on teachers? And perhaps that's something we need to think about as well in terms of those front lines. And you yourself will know from that frontline experience that there's not just in NHS, but a whole raft of key workers who found themselves on the front line throughout.
Yeah. Well, actually, I've done it. I've been working with the education team, engaging with teachers and head teachers a lot. I've been doing a lot of work with teachers and mental health, and teachers have been put through the ringer, and I think are the unsung heroes of the pandemic. I mean, I've got to be honest, like firstly on one level, right, I mean, me and homeschooling are not friends, and I just think the amount of patience that teachers have is phenomenal. But also just being in the background now, because kind of homeschooling changed to a bit more of a formalized structure, seeing the energy, love and commitment that teachers are bringing to these Zoom calls every single day, while also having children in the classroom. They've been forced to step out of their comfort zone, do things they've never been trained to do, all with a smile on their face, all while trying to support children that need extra help, who might need CAMS referrals, who are really, really struggling. And I feel that some of the narrative that has been coming out of the government, like they've had a year's worth of holiday, they need to like give up their holidays in the summer. I mean, for teachers to go to work fearing for their own health and safety throughout the pandemic, let's not forget they were walking into huge classrooms of children like literally without social distancing, they were literally walking into COVID insecure zones every day and doing it with a smile on their face. And I know it has affected their mental health. And I know a lot of head teachers have had their mental health affected as well. And I think it's super important that we recognize this, which we do, and work with them and talk about how we can support them even more when we come out the other side of this. But Kate Green and her team are also doing really good work on this, and we're working very, very, very collaboratively on it.
Absolutely, absolutely. And I'd like to bring in just one or two on the call. So Chris, we'll start with yourself, then we'll move on to Jasbinder and Andrew as well.
Yeah, thanks, Rob, and thanks for your input, Rosena.
Hi, Chris.
Hi, I can assure you we will be holding the government to account for all of the statements that they are making, and some of it is frankly shocking.
Oh, it's ridiculous.
And they're not just rewriting history, they're reinventing it, and I think that's unacceptable. And I recognise what you've been saying about young people. I have a 14-year-old son, and he has found this second part of lockdown much harder than the first. They were back in the classroom, then back out again. They went back in and somebody contracted the virus and they were back out again. It's been incredibly difficult. And you're right about teachers being unsung heroes. And there are other unsung heroes like care home support staff.
Oh gosh,
heroes,
yes,
doing some amazing.
Yes, they were
work.
included in the Care for Carers package. Actually, we said everybody counts, everybody matters.
Yeah, there are a couple that I just wanted, a couple of groups of people that I just wanted to highlight, because my day job, I work for Health Watch, and we take a lot of calls from patients and residents. And there are a couple who seem to be suffering particularly. One is carers themselves.
Yeah.
When they have somebody, particularly somebody with a debilitating long-term condition they're caring for, the mental health of the carers is being hugely affected by the isolation, the anxiety, and the rest of it.
Gosh.
So that was one lot, and we get a lot of calls about that. And the second one is the general prevalence of anxiety-related conditions. So what we're now talking about is building back better. And we're beginning to say, let's restore services, let's have business as usual. But actually, I think business as usual was part of the problem, and we need to build back with the legacy of COVID in mind, including the anxiety legacy that is going to be there for some time. I've got people now who are refusing to access dental services because they are too anxious to do so. Even in the rare places where the NHS dentistry is available, they're too anxious to access it. They're too anxious to access GP services. They're too anxious to go to outpatients.
Is that, sorry, Chris, if I can ask you, is that because of a fear of contracting COVID? Because we saw that a lot. Or is it now just generally they kind of are finding social situations really, really frightening?
It's a bit of both, and some of it is the scare stories about variants with that, and a lot of it is misinformation.
Yeah,
they have been misinformed about what they can do to protect themselves and their families. And I think it's become very difficult for them to access any social or clinical situations at all. And they're now people who've lived alone for a year, and their only contact has been with the Amazon driver or the Ocado driver or whoever it is that comes to their home. And they're finding that incredibly difficult. And we're getting a huge amount of anxiety-related concerns being expressed to us. There's a dentistry legacy building up now that we will take a very long time to clear. And I'm not sure how we're going to set about doing it, because talking to dentists, they're leaving the profession anyway, because they can't stand the stress of it all. So there's a lot going on about legacy. And when we restore commissioning with the new commissioning arrangements, we have to commission with that legacy in mind, and not simply say, let's see if we can restore the services to the way they were pre-pandemic, because I don't think that will cut the problems that are emerging.
No, I really agree. And just, I know we have to move on, Rob, I'm aware, but just in terms of if you can ever think of anything that we could do together, even on the anxiety issue, or any sort of campaigns that we could do jointly, just let me know. because that's the whole thing, isn't it? You are the eyes and the ears on the ground, and I rely on you to do a good job. As in, like, for me to do a good job, I can only do that if I hear from you. And so thank you for that. That's not something I knew, and I've learned something. So thank you.
I'll drop you a line, Rosena.
Thank you.
Thanks, Chris. What I'll do, Rosena, if it's okay with you, we've got a few hands up and we've got questions flooding into the chat, which is fantastic to see. So I'll let me start taking them in twos, and then we can sort of try and get through as many as possible. So Jasbinder, we'll go to you, then we'll bring in Andrew, if that's okay.
Okay, thank you. My question for Rosena is, obviously, I work in a secondary school myself, and I have been going in twice a week to work with our vulnerable students and the children of key workers. Now, obviously the children will go back on the 8th. Now, the first time they came in, it took us about 3 months to get them talking again properly, communication skills. And this is the second time. So I think it's going to take us a long time to get them really to open up to us again, their communication skills with their friends, with the teachers. And I just think, we need to have a lot of things in place in the schools. Although, I mean, obviously the councils are helping, to put, the right people in place. But I think the impact it's going to have on these young people, especially with year 10, who've lost year 9, they've lost year 9, they've lost year 10. The impact in their learning is absolutely massive. It's not only they're worried about their learning, their results, but they're also worried about the impact when they go to university, about jobs. It's just so many, things that they're concerned about. They've developed anxiety, and it just goes on and on and on. So these young people in our school are the people, we really need to concentrate on, because they will go into the adult world as well. So we need to have something there. Thank you.
Thanks, Jasbinder. And Andrew, if you'd like to come in now.
Okay, you can hear me okay, yeah? We
can, yeah. Fire away.
Thank you very much, Rosena. That was really inspirational. I've got a question, and that is, I've got a close relative who suffered mental health problems and needed treatment, and now he's doing very well, which is great. But we had a feeling that mental health has always been the Cinderella of the National Health Service, and I think, don't we need to do it differently? Don't we need to do something different? Is it simply a lack of resources, or is it that we need to approach this in a different way? And I don't know the answer, but I think it's kind of reinforcing what Chris said earlier. We don't just need to go back to how it was. We need to really approach it in a very different way. And my other question is, when you talked about the stresses on children in school and so on, as a former teacher, I think we need to go forward, in some ways back, to a child-centered approach to education and away from exam factories, because children were suffering stress in schools before the pandemic, even in some cases very serious stresses, and it's got a lot to do with the system that we have, the education system we have, and we need to change that too. And then finally, my daughter-in-law works as a dentist in the NHS and was part of Sure Start, which was integrated with other efforts to approach deprivation. Then currently working in a unit which is specially set up for people who haven't been able to access dentistry through the normal channels, and mostly people with poverty and deprivation issues. That's recently been put out to tender and kind of semi-privatized. So my question there is, don't we need to fully integrate these services into a kind of poverty approach to poverty, which brings together the different elements from different directions? So in other words, it's not just about money, it's all about new thinking and new solutions to these problems.
Yeah.
Perfect. Rosena, anything you'd like to come back on there?
Yeah, so firstly, just Jasbinder first, absolutely spot on. Couldn't agree with you more on actually understanding how difficult it is for children once they go back to school. It's not that straightforward. I know I have 2 little girls, and my 7-year-old found going back to school really stressful after a lot of months, because she hadn't been able to integrate with her friends for 6 months. And then when she did, she had to stand far apart from them. Breaks were not allowed to be in a playground with any other children other than her bubble. And she was really upset. She started to get quite upset going to school for a while. And I think the reason I'm sharing that with you is because I think across all age groups, there are different and somewhat unseen things that only the experts like you and Andrew are going to know and recognize. And we are committed, myself and Kate Green are committed to hearing from teachers so that we can come up with sort of ways to recognize that. So yeah, thanks for raising it, and thanks particularly for highlighting that age group, because yeah, I mean, they're hearing that like the world's collapsing, the economy's collapsing, there are no jobs, and they're thinking, what about me? What about me? What about uni? What about, like, what can I do? So their future feels quite uncertain. But I think also that's where we can put some positive messages as well, that, that there is hope, things will build back, it will be better. And I think a lot of messaging is all very doom and gloom. So I think it doesn't help children to hear that. I think there needs to be some more positivity on how resilient the kids are actually. And like the news is all full of children are really unhappy, children are really miserable, children are not doing well at school, or their education is going to go backwards. Why isn't some of it, children have been brilliant, they've taught us so much about resilience, and they're going to come back fighting, and they're going to do really well, and we're going to support them in being their best selves. It should be more of that. And that kind of leads into like one of my points, for you, Andrew. I really have issues. I think since becoming a parent, I just have so much issue with the way children are judged and the way they're made to value themselves, and how results driven that is. What if your child is really musical? What if your child is really good at sport? What if your child, like, none of that seems to matter. It only matters how good they are at phonics or which times tables they've learned. And every child does differently at different ages and stages. And it is just heartbreaking for children to feel that they are perfect just the way they are. And yes, of course, we need to be telling them to try their best and all of that good stuff. But that comes once a child feels confident and feels safe and doesn't feel judged, and in ever-growing classrooms with ever-growing pressures on teachers, it's very easy to feel that you're only as good as your last spelling test. And that is, with every fibre of my being, on a personal level, I have a major issue with it, and I can't stand it. And on the point of yes, integrating, absolutely, couldn't agree more. And is there a way to do things better? Yes. And I've actually said in my response to the mental health white paper, service users and their families have to be at the heart of this. This has to be community driven. And I know, that as the Co-op Party, this is your ethos anyway. Like, it has to be community driven. It has to be a bottom up approach, not a top down approach. Yes, we want more community services. Yes, we know that's a good thing. But we don't need a community service that is 10 miles away from where you might live with your young person with special needs, for example. How are you even going to get there? We don't want warm words. We want people in the communities to tell us what they need, where they need it, how they need it delivered. Yes, of course, I believe we need to be keeping people out of institutions, and keeping them in their community, safe with their families. But if we're going to do that, we have to support the families, we have to support the people who are using the services, and we have to ask them what they need and what they want. And too often I've seen this. If someone has a mental health issue or suffers with things like schizophrenia or bipolar, they're written off as not having any opinion about anything. Everyone talks over them, talks about them. No one says, what do you need? We really want to help you get back into work if that's what you want to do. We want to support you in having a family. What do you need? And that, I believe, is how we build back better. That is how we don't go back to the status quo. That is how we learn the lessons. And I think we have an opportunity to really, really do that with the white paper, if we're allowed to have the input that I would like us to have.
Brilliant, thank you. And if we have time, I'd love to sort of hear more about that white paper and what you'd like to see in it. But we'll go to Duncan next, then we'll follow with Eileen as well. Are you there, Duncan? Can you unmute yourself?
Yes.
There you go. We can hear you.
Even before COVID, right, it's about all mental health trusts were unable to admit large numbers in the community requesting treatment. In other words, in the community in which I lived, we were constantly surveying that there were people seeking services, and in fact, they were not being registered because the mental health trusts were already overrun. So what is going to happen post-COVID? Surely we need a completely new form in greater numbers of community mental health workers, hopefully organized on a cooperative basis. I don't see anything in the white paper about that, but I'd like everybody to, because I think it's the only solution. We do not have currently the man and woman power to be able to cope if the situation is as serious, and I agree with you, as you're saying it is.
Yeah.
Thanks very much, Duncan. And Eileen.
Unmute.
There you go.
Okay, so because there's increasing evidence that COVID has increased online gambling harms, how's Labour holding the government to account to expedite greater provision of clinics? It's appalling that, you know, you could live 200 miles away from a clinic to help you with gambling harms. What's Labour doing also for the complete banning of gambling adverts and accelerate making gambling illnesses a public health issue, not a fragment of media, culture and sport? The House of Lords has very recently presented the fact that the big gambling companies make 60% of their profit from 5% of gamblers.
Yeah.
It's obviously the gambling thing. You know, this is, I'm not against gambling, but, you know, there's so much evidence that this is there's a suicide on average every day, which isn't categorized because of gambling, a gambling harm, and it's not categorized. It's not necessary for the medical report to say that. You know, that's the extreme of the level. What's Labour doing today, tomorrow, to get this changed?
Thanks, Eileen. Rosena.
Yeah. So Duncan, first of all, I couldn't agree more. In fact, yesterday I asked the government at Health Questions what they're doing. I basically said that people have to be at the heart of the white paper and all of the mental health reforms, and that primarily it also includes our health staff, our mental health staff. And I have been calling for more training and recruitment of mental health staff, particularly of the sort of community-based staff that you're talking about. And I think without a workforce, I mean, I literally asked this question yesterday, so I'm really, really glad that you've raised it, because it makes me look like I'm on the ball, one, but two, it's really, really, it's absolutely crucial. So, I mean, the workforce have to be front and center. Without the workforce, the man and woman power that you talked about, there is nothing. And that is what, as a Labour Party, we are going to be pushing for. And that has to be as well about making the working environment for people entering the field of mental health a good place to be in, one where they get good training, where they get support with their own mental health, and they're made to feel valued. Because we know that so many people, you know, are leaving the profession because of the stress. I can see you nodding. You've heard, you know the same. It's so stressful and very, very difficult to feel supported. So there's no point in recruiting people and saying, oh yes, we need more people, let's recruit them. What are we going to do to help them stay? So yes, that I couldn't agree more. And Eileen, so I actually had the portfolio that covered gambling for 3 years, and I worked extremely hard, like fighting the big gambling companies, all of that. It's not my brief anymore, it lies within the DCMS team. So I'm not allowed to answer for them. All I know is that Ali McGovern, who took the role after me, is deeply, deeply committed to all the same things. And in fact, actually worked a lot with the charities who, I mean, did a lot of work actually with the charities who are really sort of pushing gambling and gambling harms as being a public health crisis. Really, that's what it is. And the number of people that take their own lives, that like families are ruined and ripped apart. And also, you know, we were really sort of fighting for there not to be, you know, advertising at football matches.
I know they've been fighting for so long, and
I know,
you know, it hasn't changed.
This is why we need to get into government. This is why we need to get into government, because, you know, one day in government is worth 1,000 in opposition. You know, but we are trying. I mean, I was trying everything I can. I know that Ali is doing all the same now. It is a minefield, and it you know, I can't.
I don't understand why it's not within your remit when it's.
I
know that it's in the Department of Media, but it's such a mental illness.
I know, it's really weird because loneliness is also not in my remit, and you'd think it would be. That's also in the DCMS team, and so out of respect for our colleagues, it's, you know, like we work collegiately, but I'm not allowed to sort of step on toes. So, but I can tell you that you know, my colleagues that, you know, both deal with gambling and loneliness are superb and very, very committed. But this is the thing, you know, this is why we need Labour government. We can push all we like this end, but we can't put any of it into legislation, you know, and push it through if we're not in government.
Thanks very much, Rosena. I'm conscious to our hands up, but we are running slightly short on time. And one thing I do just want to sort of finish off on is, this is great to see, isn't it, that in what is a difficult subject, the chat is flooded with questions of what can we do? How can we help? And something that we as a cooperative party and a cooperative movement pride ourselves on is the ability to take these ideas, but put them into sort of practical solutions where we make a difference on the ground. So on behalf of everyone who's asked that question in the chat, perhaps we finish on what can we do, Rosena? How can we support you as a party, as a membership? Is it helping one another? Is it helping ourselves? Is it writing to our MPs? What can we do to be helpful to you?
That's a really, really great question. Firstly, you're already doing it. You know, having discussions like this are so incredibly valuable, because I learn things that I didn't know before that give me, you know, food for campaigning. I meet new people to campaign with. You know, I hope that some of you, if you know, when you come up with your own things, will invite me along and I can support you on that. But I think it's on a couple of levels. Firstly, it is keep on keeping on doing what you're doing in your communities. You do it superbly. There's no one better than you. And from that, try and identify themes and let me know about them, so that your eyes and ears on the ground, collectively meeting, you know, tens of thousands of people, you can spot themes like anxiety. You can bring to me issues like gambling. You can say, look, actually, we've realized this is a real issue. Is there something we can do together? Is there something we can pass on to you to ask the government about? So I believe that everything always starts local, and that is where it needs to start off. So you're doing that already. It's absolutely brilliant. But then you can, you know, lobby MPs. Like, I mean, many of you will be living in Tory seats. Don't give them an easy ride. Let them know that you see them, you know what they're doing. You want some answers. You can also come to me with ideas of parliamentary questions that you have noticed, this, and this. Rosena, can you submit a written question to the government which has to be answered? These are the sorts of things that we can do together as a cooperative party, together with me. I'm only as good as the strength of commitment of the people around me to helping me have access to the information that I need. And you know, I get lots of briefings from charities. You know, I obviously have my own personal experiences. I hear from mental health trusts and people within the NHS. But how powerful it is when I hear from you, the eyes and ears on the ground, and that is hugely important, and I think that that's the best thing that you can do. You know, bring me your ideas, keep doing what you do, let me know how I can support you, and just keep lobbying MPs that don't want to listen, Tory ones.
Absolutely, absolutely. I think that's a great place to finish, I think. And first of all, perhaps before we go to you for any final comments you may have, I just want to say thank you to everyone for joining us, and apologies again to those who we couldn't quite get to with our questions. But I feel like on this issue with Rosena in particular, we could go on for the next few hours. So we'll try and sort of finish while we can. But Rosena, before I pass over to you again, just on behalf of everyone, a huge thank you for joining us. I know how busy you'll be, and we've seen such a range you have to cover at such difficult times. So a huge thank you for making the time and joining us tonight. So I'll pass over to you for any final words you may have, but just a massive thank you for all of us on the call from the Co-operative Party as a whole.
Oh, thank you so much. Firstly, I'm really sorry to anybody that I wasn't able to get to, but if I can just ask one of my team members to please put my email address in the chat, or people can get it from you, Rob. I'm really more than happy if you want to email me your question, and I'm really happy to answer you. So sorry if I didn't get around to you. I chat a lot, so let's go on a bit. But honestly, just thank you so much for having me, and thank you for all that you've done over the last year. Like, our community has been torn apart, and I know that the work that you have done will have made a huge difference to thousands and thousands of people. Some of the people whose lives you would have touched that you may never even know that you did, but just take heart that you did, and that collectively we are so incredibly strong. And we may have a Conservative government, but all around the country we have pockets of Labour and Co-operative Party leadership everywhere doing incredible things, and we need to draw on that. And we also need to look at making gains and getting more in May. And I just really want to end by saying that honestly, there really is light at the end of the tunnel. I think it's really important to stay positive. We're almost through the other side, and look what we've achieved. Look what we've done for the people that needed us the most. Every single one of you should be incredibly proud of yourselves. And the Co-operative Party campaigns have blown me away. They've just been brilliant, and you've not stopped despite there being a pandemic. And it's just, I'm so proud to know you. And the last thing is, I always say this, is it's okay not to feel okay. If any of you are ever struggling with your mental health, there are people you can turn to, and if you really need to, you can get in touch with me. You know, I'm always happy to point you in the right direction or help you in any way that I can, but you're not alone. And I think the fact that we're all in this call together, we should know that and feel that. And I believe that love can travel over the internet. So I'm certainly feeling the love, and I'm sending it back to all of you. And I'm really hoping we can do this again soon. And if you want to do this again soon, in a couple of months, and like revisit some of the issues, it'd be great, to hear from Jasbinder, for example, how it's been for the kids going back to school the following time. I can find out a bit more about what's going on with the gambling and let Eileen know, and we can have a good chat. And Duncan, hopefully you would have seen that I would have been badgering the government some more on the workforce. So I'm really, really happy to come back again.
Lovely. We will have to take you up on that, Rosena. So thank you again, and a lovely note to finish on. Thank you to you. Thank you to everyone. Keep an eye out for our future events, and we hope to see you all again soon. Thank you.
Thank you so much, everyone. Thank you.